I think cardiopulmonary resuscitation is portrayed as quite often being successful within the media and within television programmes. And we need to be very honest as healthcare professionals with the patients and their loved ones who we're discussing resuscitation with about the likelihood of recovery from a resuscitation attempt. There is an expectation that we can resuscitate everybody and we can do that successfully, and we know the outcomes from cardiac arrest, particularly those arrests that happen outside of a clinical area, are pretty poor in terms of percentage of recovery to any meaningful quality of life and discharge from hospital. Because a lot of the conditions that lead to the heart stopping at the end of life are by nature irreversible. And again, that brings us back to the underlying conditions that the patient may have, along with frailty of their system as well, which contributes towards the chance of survival being very, very poor.
Lots of people are not clear on what potential outcomes could be. For example, significant neurological damage. If patients are without oxygen for minutes even, that can significantly impact upon their brain function permanently, pushing down ribs and potentially causing harm to the patient. And I think people often don't understand that. Usually when that's explained to the patient of what that involves, often they will understand that this is the decision that is made. It's important to understand that actually sometimes these discussions don't have to happen in one sitting, and DNAR discussions or advanced care planning discussions often take multiple discussions, even on the ward. If you involve different teams and people saying things in different ways, or even just repeating things or clarifying things, that in multiple sessions can sometimes help patients or their families to understand what it means.